Good afternoon. My name is Ryan Ferns. Do you like the thought of your child telling you that they were pregnant or they have contracted HIV? I didn't think so. Did you know that by providing condoms to high school students, it would give your child some protection against pregnancy and STIs? I'm here to discuss why condoms should be distributed in high school. I'm sure some of you are thinking, my child doesn't need condoms. Every day, thousands of teenagers are putting themselves at risk for pregnancies and sexually transmitted diseases. Every year, there are millions of children born that are brought into this world unwanted or abandoned, many which are born to young teenagers with little or no education about condom use or sex. With a little education about condoms and safe sex practices, many of these unnecessary pregnancies and transmission of sexually transmitted diseases could be prevented. Many parents do not educate their children about sex, therefore the burden usually falls on the schools. Today I'm going to share with why I believe condoms should definitely be available in high schools. Condoms reduce the spread of STIs. According to a 2018 survey conducted by the Centers of Disease Control and Prevention, 40% of high school students are sexually active. The number of teenagers contracting an STI is on the rise. In 2018 alone, there was 20 million new reported cases of STIs. The ages ranging from 13 to 24 years of age, and 21% were diagnosed with a human immunodeficiency virus, also known as HIV. The numbers from the CDC stress the importance of condom distribution in high schools for sexually active teenagers. When condoms are used correctly and consistently, they are highly effective in decreasing the STI transmission and effective in decreasing the chance of contracting HIV. We may not think about our teenagers having sex during their high school years, but they are. So schools need to help them stay safe. HIV, AIDS, and herpes are STDs that are not treatable, and the person who contracted the STD must live with their disease all their life. Children as young as 12 are having sex. The majority of these children are as young as 14, and after losing their virginity, they're secretive with their parents about their sex life. Since these teens are being secretive, that means they are not seeking medical attention. STDs are going undetected. Condoms help prevent teenage pregnancy. While abstinence is encouraged among high school students, parents aren't naive. The numbers from the CDC strongly suggest that expecting abstinence is not realistic. The American Academy of Pediatrics Committee on the Adolescents knows this, and therefore advocates against access to condoms in schools as part of comprehensive sex education programs to mitigate cases of unwanted pregnancies as well as AIDS and STDs. According to the research from Teen Pregnancy Trends, over the last 20 years, teen birth rates across the United States have been continuously declining. In fact, the teen birth rate in 2017 dropped 7% from 2016 and dropped a whopping 70% from 1991. Many factors have been linked to this decline, but especially prominent is the increases in contraception use among teens. As teens spend the majority of their time at school, it is the most natural and convenient place for sex education, including condom distribution. What if she gets pregnant? Statistics show that in 2012, there were 29.4 births for every 1,000 adolescent females ages 15 to 19 years of age, or 305,000 babies born to females in this age group. Not all teen births are the first births. In 2012, almost 1 in 5, or 17% of the births, to 15 to 19-year-olds were females who already had one or more babies. Students of that age group are not ready to take on the responsibility of raising a child, and it could affect how their future proceeds. Will they graduate? It is possible that students who have a child at that age can graduate, but the rates of graduation are decreasing. Students from trends in teen pregnancy show that 30% of all teenage girls who drop out of school cite pregnancy and parenthood as key reasons. Only 40% of teen mothers finish high school. It is less likely for a student who does not finish high school to go to college and finish. Studies also show that fewer than 2% of teen mothers finish college by the age of 30. Condoms make teens more sexually responsible. According to the American Academy of Pediatrics, the condom remains the most popular used contraception method among teenagers. As teenagers are beginning to discover their sexual identities, providing condoms in high schools can help them establish the concept of safe sex as the norm and gives them the mandate to be responsible. Introducing the idea of condom use into their mind at such a formative age may help teens view contraception as second nature, as opposed to something that either gender will have to continually negotiate with future partners. Some may say free condoms shouldn't be distributed in high schools because it could interfere with family and religious beliefs. By providing condoms to students, high schools are taking away the due right of parents to decide whether their own teenage child should have access to contraception. To begin with, many parents don't think that their adolescent children are emotionally or physically ready yet for sex. So having schools introduce condom use to their teenagers pressures both the parents and teens into having conversations about sex that may feel premature. It also may interfere with a family's values or religious beliefs. For instance, the Catholic Church and other contraceptive faiths oppose various forms of contraception. Parents who support the cause can provide condoms to their teenagers without having schools infringe on other families. Timelines of talking about sex and our religious freedoms. Condoms are not 100% effective, which gives teenagers a false sense of security when having sex. This is because most teenagers lack experience with condom implementation and use, causing the condoms to be extremely ineffective. When used perfectly every single time during sex, condoms are 98% effective at preventing pregnancy. People, especially teenagers, aren't perfect, so typically condoms may only be about 85% effective. Not to mention that the fact vulnerable teenage girls still have less control over condom use. In high schools that teach students about both abstinence and contraception use, these programs are sending mixed messages to students. If a school wants its students not to have sex, it shouldn't provide them with condoms to use during intercourse. Furthermore, making condoms available in school might send the erroneous message to students that their teachers and parents are expecting them to engage in sexual activity. According to Michigan Teenage Pregnancy Prevention Initiative, condoms are 90% effective. So if the goal is to increase the use of contraceptions among sexual active teens, the condoms should not be hidden behind counters of local stores. Instead, they should be in areas that are heavily populated by teens, like in schools. Having condoms readily available to students is a necessary and effective way of ensuring that teenagers are making healthy and safe decisions. A condom availability program would open up the conversation about sexual health, eliminating the stigma associated with condoms and contraception. Thank you.